Hi, my name is Michelle Hamble, and I'm the program manager here at Remlex Healthcare Services. And we're going to be talking about everything that has to do with being a DSP. So let's get started. So we're going to go over an introduction to developmental disabilities, what an individual support plan is, person-centered thinking, communication, positive behavior support, therapeutic relationships, professional boundaries, HIPAA, emergency preparedness, health and safety, advocacy, and coping with stress and burnout. So, is intellectual disability the same as developmental disability? Not exactly. So, an intellectual disability is a disability of the mind. Um, a developmental disability is any disability that affects the physical presentation of somebody. There's a lot of different causes of ID and DD, but ID is a type of DD, so you can't use the words interchangeably. But intellectual disability has to do with somebody's cognitive functioning, and developmental disability has to do with somebody's not appearance, but physical abilities. And intellectual disability can be at a result of a developmental disability. So, developmental disabilities include people with autism, cerebral palsy, and other mental or neurological conditions. May only be physical, so somebody could just have a developmental disability and can be completely function 100% cognitively, may or may not have an intellectual disability. So, some causes of intellectual disability can include genetics, other physical causes, social and environmental factors, or unknown. Sometimes we don't know why. So these are some common myths and misconceptions about people with disabilities. So people with developmental disabilities are all alike and all require the same supports, just like people without developmental disabilities are not all alike and all, we all don't require the same amount of supports and attention and healthcare. Is the same for people with developmental disabilities. People with developmental disabilities are ill or sick, which is very false. All these individuals are born that way, born with those supports. So we can't say that somebody's ill because it's not a virus. People with developmental disabilities need specialized services to meet all of their needs, which is not true. There are people with IDDD who never, go into services or never require services like ours. So, the uniqueness of your position or somebody that's a direct support professional is that you get to see the person and not the disability. So, we are focused more on who the person is, what their interests are, their personality, their history, their culture, their background. Like, we want to know about the person. Yes, we know about their disability, but this is just information about who that person is. So, we see the person and not the disability. We're creative and we take each person's wishes seriously. So, if your individual tells you they want to learn how to fly a plane or they want to go skydiving, we're going to find a way to help them do that. It might not exactly be skydiving. I mean, if they can afford it, then why not? But we can help them find things to fulfill dreams and goals that they have. We're positive and we don't let history get in the way. And we're a model for others. Us being in the community with our individuals is really good for the community and for society to see how you can interact with somebody who has disabilities. We're breaking down those stereotypes, we're breaking down those stigmas, and we're modeling to people what it is, what interacting with somebody with a disability can actually and what it should look like. So, an individual support plan. So, an ISP outlines the services, activities, and resources needed for an individual to meet their goal. It is developed for people with waiver services. It includes information about the individual's needs, the services that will be provided, and when and where those services will take place. Developed in collaboration with the individual, their family, and other providers, reviewed and updated annually or more often if needed. So, an ISP is has five parts: the personal profile, the essential information, the shared living, agreements planning, and part five. So all the ISP is put together by all the people who support that individual. So their case manager, their family, maybe their group home manager, whoever supports that individual, all comes together and they write out how a DSP will support that individual in various settings. So the only part of the plan that you really get to see is part 5 of the plan, which I'm going to print out and give to you, or somebody will print out and give to you. So yeah, that's the most important part that you need to know about the ISP. That has the plan for supports. It has each outcome, and how, by in detail, how to support that individual with each outcome. So yeah, this is an example of what an ISP look like. So you can see the box that says desired outcome, and then you see the key statements or the activity statements, and then we write. We answer all of these questions. A part of my job is writing part fives. So, in the importance of accurate documentation, if you haven't already watched the documentation video, then this can be helpful. But if you already watched the documentation video, this is just an overview of documentation already. But documentation is important to ensure that the individual is being supported in achieving their desired outcomes for their life, to ensure continuity of care, to improve accountability between you and the individual, to give credit for the quality of work to do, and for oversight. So, person centered thinking is when you put the individual or the person that you are helping in the middle of your thinking or in the middle of all of the supports. So, we are listening to the individual, we're listening to their choices and we're respecting them. We're focusing on community. How can we help this individual build relationships with family? How can we help this individual build relationships with friends? How can we help this individual build relationships with people in the community? Self direction. We're encouraging self direction. We're encouraging independence. We're encouraging these individuals to make their own choices. And we can do that by giving them informed choices. So explaining to them, you have diabetes and you really want to eat this high sugar ice cream. Are you sure? If you eat this ice cream, it's going to spike your blood sugar. Do you want to do that? And if they still choose to do that, that's self-direction. They've chosen to do that. They know the risks. That's your job to give them the options and the education to make informed choices. And we cannot control or make choices for them. We just give them options, we give them education, and they make their own decisions. We focus on talents and contributions of the people. Our individuals are very unique, just how we are very unique. Our individuals, some play instruments, people work, people do a variety of all types of things. So focusing on who they are as a person, maybe they're a teacher, maybe they're a nurse. Like praising them for the contributions and their talents and not focusing on just their disability. And we have a responsibility to support our individuals and to help them make informed choices. So, what is important to and what is important for? So, important to are those things in life which help us to be satisfied, content, comforted, fulfilled, and happy. I summarize this more as what is important to me, what do I want? And then important for is what is important for me and what do I need. So, for example, I want to, I like to use food as an example. I want to eat fried chicken, but it's important for me to manage my high cholesterol. So you need to learn how to balance those things with the individuals that you support, because it could be important to them to exercise, important for them to exercise, but it might not be important to them to exercise. So learning how to balance and like give options, like, hey, I know it's not important to you to exercise, but it is important for you to exercise. So why don't we, go for a walk? If they don't want to exercise, I wouldn't suggest going to the gym, but finding things that would be fun, easy for the individual to do. So that's the balancing of the four and the two. So as a DSP, you should see the person and not the disability. Listen to and respect the person's choices and preferences. Balance what's important to somebody and what's important for them. Record what's learned to improve the support provided. Honor people's rituals and routines. learn backgrounds and cultures, encourage talking for oneself. So, encourage your individual to talk for themselves, to advocate for themselves, to ask questions, to talk to store associates, to people in the community by themselves. And that's a very common thing for people to be uncomfortable. Like community members who are not familiar with people with disabilities to be uncomfortable, possibly like maybe talking to your individual directly. So they might feel more comfortable asking you. But you, as the DSP, need to direct those questions to that individual because they're the individual is who needs to answer the question. So encourage them to talk for themselves. I also kind of want to go back to honor people's rituals and routines. So you have to remember, especially if you're doing an in-home service or you're spending any time in the individual's house, that you're stepping into somebody else's life, that you're stepping into somebody else's rituals and routines. People might want to keep their house a certain way. People might want to, not want you to wear shoes in their house, might not want you, that they want to eat dinner at a certain time. Your job is to support, not to make choices for them, not to change their routines. You can give them options if they are engaging in behaviors that are not productive or helpful, or maybe their routine or ritual is not productive or helpful. You can give them options, but it's not very helpful to try to change people's routines. And that's when we see a lot of, maladaptive behaviors because we try and control people. And at the end of the day, people with disabilities are people with their own wants and needs, and we cannot control them. Ask for permission when supporting. Even if, like, and that's something that I always like to do, like when I go to somebody's house for the first time, even if the person knows I'm coming, even if they know that I'm their support staff, I'm still going to ask them if I can come in. Like, you want to respect somebody's, like, space and respect them. If you're helping with, especially when you're helping with personal care type of duties, asking to touch them, asking for consent, like, hey, can I take off your shirt? And wait, and they'll indicate to you in their own way if they're nonverbal by nodding their head or by raising their arms up to allow you to. But like, always respect the person, because if you respect them, most likely they'll respect you. Using person first language, so referring to them like they're adults and not talking to them like they're children. Using everyday language, so just speaking to them and relating to them normally. Consider your tone of voice when you speak to them. You're not their parent. You are a support. So don't talk to them sternly. Don't talk to them like they're children. Don't use jargon and labels. And remember that your attitude and your interactions influence others. So if you come into work very mad and upset, your individual can pick up on that. So trying to leave those things at the door when you're coming in to support your individual. So, communication, there's multiple ways that somebody can communicate, especially with this population. Especially, so speaking, I guess, is the most encouraged form of communication, but people can also communicate in writing, in gestures, by, hitting their hand away from you if they don't want something, pushing something away from you to indicate they don't want to do something, moving out of the room if they don't want to be there. Body language, are they crossing their arms? Are they furrowing their brow? Are they, sticking their tongue out at you? Like, body language can also indicate like feelings. Signs, some people use sign language. Behaviors, and like, so seeing behaviors as a form of communication. A lot of individuals, especially if they are nonverbal or if they haven't learned how to express themselves efficiently, will act out or use behaviors as a way to get attention, especially if it's been reinforced. So, for example, like a child, not to compare somebody to with disabilities to a child, but let's say with a child, like they know, like a toddler, they know if they cry, they can get what they want, right? And we can apply that to adults, like they've probably learned that this action or this behavior gets them the solution that they want. So it's your job to read those signs, to read that body language and figure out a more efficient way for them to communicate what it is that they want to communicate without, being aggressive or being harmful to themselves or to other people. And their actions can also be forms of communication. So yeah, communication is expressive, like how I'm doing, I'm talking, or you are, and receptive, which you are doing, which you are listening. So notes to help with communication. Don't assume that not speaking means not understanding. So don't assume just because somebody is nonverbal or doesn't actively listen, like shake their head, means that they're not understanding you or they're not listening to you. Listen to what people say with their words and their actions. So an individual can tell you they're fine, but you can see that they're in pain. Take the time to understand what someone is saying through their actions. Like, don't write off a behavior because it's difficult or hard to deal with, but take the time to really learn. Like, if this individual keeps, hitting you or keeps like throwing things off the table, why are they doing that? And if you need help figuring that out, you can reach out to your supervisor. Model age appropriate and positive communication. So always think about the age that they are, and model what positive communication looks like. Respect that everyone needs to communicate, know that behaviors are ways to communicate, and help find ways for people to express themselves. So, a positive behavior support plan is a plan that is developed to help an individual reduce. But yeah, so the behavior support plan helps reduce maladaptive behaviors. And that's just a more specific plan that will go into depth about how to deal with certain behaviors while they're occurring. So, positive behavior support has four basic values: respect for the rights of all citizens, respect for personal choice and control, um, dignified treatment of people, assurance that people with disabilities are not abused and neglected. So, as a DSP, you should always follow positive behavior support plans. See all behavior as communication. Like I said in the previous slide, even if the behavior is challenging, trying to figure out why. Always look at the why for things or how you can help reduce that behavior. Because simply like ignoring the behavior or trying to like push the behavior away is not going to get rid of the behavior. Seeking ways to increase control, choice, and control. So seek ways for your individual to be more independent. If they're nonverbal, giving them options, like letting them point, letting them grab. So always seek ways to allow your individual to have more choice and control in their life. Teach new positive ways of meeting needs, because like I said, some individuals can use challenging behaviors as a way to meet their needs. Instead of communicating. So teach them how to communicate, teach them how to do different things instead of participating in unproductive behaviors. So, as a DSP, you have a therapeutic relationship with the individual, but you also have to remain professional boundaries. So, DSPs are considered to be professionals in the caregiver individual relationship. A DSP is expected to maintain a therapeutic relationship and nothing else. DSPs develop long term relationships with those we are charged to care for. We grow to love them and will do a little extras for them. Usually, that doesn't present a problem for anyone, but there are times when relationships become unhealthy for DSPs, for the individuals, and for the other individuals they are assigned to. Sometimes individuals develop a fondness for a DSP that isn't healthy. The individual becomes dependent upon the DSP's presence to be happy. He or she refuses to allow other DSPs to work with them, and DSPs have bad days and the individual can have bad days until their favorite DSP comes, and they can have a bad day if they don't show up. So it's harmful for the individual and it's harmful for you to cross boundaries and to cross professional boundaries, because if you allow yourself to become so important, or or allow the individual to depend on you for their emotional needs, for happiness, for support, and you're not teaching them skills, then boundaries can be crossed and you can become burned out. So making sure that you're always being professional. It's okay to say no to things that you're not comfortable doing, and that depends on the situation, of course. Like it could be like an example could be, do you want to come to my birthday party? If it's not during your shift, the answer is no. You want to avoid crossing any boundaries or doing things that you cannot sustain. So you don't want to be paying for their food. You want to encourage them to pay for their own stuff. If they don't have the money, that's an opportunity for you to teach them a skill. Like, hey, when you want something, you need to have the money for it. If you don't have the money for it, you can't get it. So not crossing boundaries. You are a DSP, a direct support professional, and they are the individual. So always remember that, and always keep your boundaries very firm to avoid, over attachment and burnout. So, if you are currently working with the individual, these are some questions that you can ask yourself. And for people that haven't worked with individuals, remember, not to spend off duty time with the individual or family. I get it, maybe they have a sibling, and their family's like, oh, can you babysit my son and I'll pay you, outside of your hours? No. We do not spend off duty time with the individual. We do not keep secrets for the individual and the family. If you feel like something alarming is going on in that home, please let us know. Do you become defensive? Don't be defensive. Don't always be objective when you're talking to your individual and to other people. Like if your individual is participating in behaviors that are not good for them, or they're being toxic, maybe in a friendship or in a relationship, you can tell them that, hey, that behavior wasn't so nice. Like, always defending them and always stepping in to justify their behavior could be a sign of crossing boundaries. Not being too attached, not being romantically attracted or attached to your individual, and not choosing sides against the individual or against the individual's family. Just being as professional as possible. So it's not as common as client DSP friendships, but it's much more dangerous. So being attached to the client's family can really stress out the family and stress out the individual. So you want to try to keep communication through the proper channels. They can text you or call you if it's about their individual, maybe during your work time, but outside of work hours, you probably don't want to pick up. If it's a question that you can't answer, refer them to me or to another admin staff. So, how to handle overattachment? If you find that you're overly attached, first thing to do is recognize that you're attached, and then trying to distance yourself from the individual or the client. So, for some people, this is done gradually, so slowly moving away from the client, because maybe pulling away completely could cause a really, stressful situation for the individual. And for others, it's more appropriate to just cut things off completely. If you ever feel like you're getting over attached or your client is getting over attached to you, please talk to us so that we can change your assignment or find you a more suitable case. So HIPAA. The HIPAA privacy rule establishes national standards to protect individuals' medical records and other individually identifiable health information, and applies to health plans, clearing houses, and those health care providers that conduct health care transactions electronically. The rule requires appropriate safeguards to protect the privacy of protected health information and set limits and conditions on the uses and disclosures that may be made of such information without an individual's authorization. The rule also gives individuals rights over their protected health information, including right to examine and obtain a copy of their health records, to direct a covered entity to transmit to a third party an electronic copy of their protected health information, an electronic health record, and to make corrections. So HIPAA is any information or PHI, personal health information, such as the person's name, their address, their telephone number, social security number, email address, medical record, diagnosis, treatment plan, anything that has to do with your work with that individual, the individual's personal information is not to be shared with people that work outside of REMLEX. So if you can talk to me about your individual, you can talk to another DSP about your individual, but we're not talking to our mom and our dad and our cousins and our aunties and our friends about our individuals. And if you are, maybe you can, talk about a specific situation, but don't talk about the person's name, don't talk about where they live, don't take pictures of the person. Just try to protect the person's rights, because if you were in a position where somebody was helping you and coming into your house every day, you wouldn't want them going outside sharing your personal information with other people. So please keep information secret. um, so HIPAA also covers these. So you are allowed to talk to other healthcare providers that provide for, or other DSPs that assist the patient. And if you're unsure about if you're allowed to talk to that person, just, it's better to be like, hey, I don't feel comfortable sharing that with you. Maybe you can ask my supervisor. Um, so yeah, so these are some steps that you can take to be compliant. So make sure no one else can see health or personal information on your computer while you're working. So if you're not in the office, or maybe you're out in the community, or if you're in a public space, turning that computer away. Maybe if you're using a computer at home, logging off the computer when you're done. Don't give confidential emails and information in emails or text messages. If you're texting me about an individual, maybe you can use their initials, or you can summarize information, but try really, really hard not to put full names in emails or in text messages. Do not leave documents or medications out where other people can see them. Store file documents according to our facilities policy. So all of our documentation that you will do is on your phone. So just keeping that phone private and secret is all you need to do. Um, Make sure you're in a private area when you're listening and reading messages. Know who you're on the phone with before you start giving information. When talking to a care team member or the doctor's office on the phone, use landline phones, not cell phones. I guess cell phones can be scanned and hacked. Don't talk about residents or clients in public spaces. If you see residents or clients in public, be very casual with your greeting, but try not to give too much information to people who may not work with that client. So, emergency preparedness. We're going to do more training on emergency preparedness, but emergencies and disasters can strike when least expected and without warning, forcing individuals to evacuate quickly. The increasing frequency of natural disasters in this country presents a serious challenge for millions of individuals with disabilities and their caregivers. Emergency preparedness refers to Emergency preparedness refers to a framework of steps designed to help ensure an individual's safety before, during, and after an emergency or natural disaster. So, in disaster situations, individuals with disabilities are less likely to receive timely warnings before an event, often unable to evacuate due to a lack of accessible transportation, frequently evacuated to emergency shelters that are inaccessible or unable to accommodate their needs. So, I'm going to give you guys a form where that you can take home, and like just to think about the individual that you support, and their needs, and their impairments or their disability, and think about how in certain situations how you would help that individual get out of there as quickly as possible. So if your individual can walk, can walk really quickly, can run even, it might be easier for you to develop a plan. But for somebody who's probably in a wheelchair or may not be able to walk as fastly or efficiently, develop a plan too. If you have to shelter in place, if you have to wait for more support to be there, just develop a very realistic plan so in emergency situations you'll know what to do. So, some possible disasters that require evacuation can include floods, extreme temperatures, tornadoes, fires, health threats, hurricanes, thunderstorms, um, extended power outages, terrorism, and active shooter incidents. So, think about these kind of incidents when you're creating your emergency preparedness plan. So, health and safety, maintaining good health through nutrition. All people need good nutrition. Special diets help with difficulty chewing or medical conditions. As people age, nutrition becomes even more important. So, depending on your individual, and once we read through their case, or if you've already read through their case, you'll know what supports they need with eating. So, if they have difficulty chewing, helping them maybe by blending down their food or giving them options that are textures that they can eat, um, so like helping them in any way possible, and just reminding your individuals to possibly try to make good healthy options. Maybe trying not to pick the lower sodiums or the less sugar options. It's not a requirement, but it's something to think about. It might be a requirement depending on your plan, but it's something just to think about and to encourage your individual to do. Um, while you're working with them. Same thing for personal hygiene and dental care. It might be a part of your plan to, focus on their personal hygiene, but if it's not, just remembering that hygiene is very important, that dental health is very important, because without proper like dental hygiene, it could lead to a lot of different health diseases. So finding nice, respectful ways to encourage good hygiene and good dental care to your client. Obviously, depending on your relationship, if you're very familiar with your individual, you're very close to your individual, you saying, you might need to go take a shower, could be funny and, like reinforcing for the individual. But some individuals don't like that. So being respectful, learning your individual, and learning the best ways that you can give suggestions, especially when it's about personal hygiene. Because if you didn't know somebody and they come to you and told you that you need to take a shower, you would be offended. So learning how to respectfully help and support your individual with their personal hygiene and dental care. Um, so you will receive first aid and CPR training. If there's an emergency, call 911 before you call me. Because if you call me, I'm going to ask you, did you call 911? Please call 911. Any condition which would be considered an emergency if it happened to a member of your family is an emergency. So call 911. So some health concerns that are pretty common with people that we support include diabetes, difficulty walking, sleep apnea, food or drug allergies, emotional outbursts, elopement and wandering. So elopement and wandering could be elopement like running away. Maybe you can't find the individual. Skin care. So pressure sores are basically like if you're working with an individual who sits in a chair or maybe is always in bed due to like not being able to walk, they can develop sores that can be like hot warm to the touch, that can be different colors. So you want to look out for those things when you're working with people with disabilities. There's a risk for aspiration pneumonia. So depending on their disability, eating can be a bit difficult or different than it would be for somebody who doesn't have a disability. So they could possibly inhale their food, maybe in the shower, they're inhaling the water, maybe they threw up. Like while they were laying down and inhaled the throw up, just inhaling anything that's not air and it building up in their lungs can cause pneumonia. So if you notice that your individual is coughing up phlegm that looks kind of, suspicious, like it's dark, it's discolored, maybe blood, please let us know about that. Falls, UTIs, urinary tract infections, dehydration due to not drinking enough water, or maybe taking medications that dehydrate them, or maybe taking medications that cause them to pee or to have a lot of bowel movements. So they're at risk for dehydration. Um, Constipation and bowel obstruction, sepsis. Sepsis is when a health condition or viral infection progresses very quickly. So maybe one day, they're just coughing, and then day two, they're in the hospital hanging on to life. So sepsis is very serious, and people that we work with are at risk for sepsis. Seizures is also another health concern for a lot of the individuals we work with. So the rule of thumb is if your individual is known to have seizures, it is in their plan, it's a diagnosis, they might take medication for it. If they are known to have seizures and they start having a seizure, you're going to want to put a cushion under their head, whether that be a jacket, a towel, whatever is available, a pillow, if possible. You want to lay them on their side, preferably their left side of their body. You're gonna make sure there's nothing in their mouth. You're going like so that they can breathe clearly. And you want to time that seizure for 5 minutes. So if they already have a known seizure disorder, if the seizure is under 5 minutes, and they get up, they're fine. Maybe they take their medication, they go to sleep, they don't have another seizure. Document it. It's a part of their daily support. But if somebody is not, or okay, But with somebody that is known to have seizures, if they're continuously having seizures, like maybe they have a seizure for like a minute, 2 minutes, they stop, they're fine, and then they have another seizure for 1 minute, 2 minutes, they stop, they're fine, they have another seizure, call 911. If the seizure is longer than 5 minutes, call 911. And if the person is not known to have seizures, they've never had a seizure before, they're not diagnosed with a seizure disorder, as soon as they fall down and start seizing, call 911 and let me know. Let your supervisor know. Let any of the admin staff know. And difficulty with sight or hearing. So learn about your individual's unique medical needs. And all of this is going to be in their ISP and in their Part 5 or their plan. So, exercise. Exercise. So, DSP should recognize that people they support may not have experienced an exercise routine with Foremost Fitness Plan. Know that 30 minutes of exercise is recommended most days of the week, and be creative and think of ways to get your individual moving in a safe and healthy and a preferred way. So, if your individual already goes to the gym, already is active in the community, this may not apply to them. But if you have an individual who might have some mobility issues, or excuse me, who probably just doesn't like exercising, maybe do some just dance, or like take them out for a walk, or take them to the mall and walk the whole mall. Like, try to find ways to encourage your individual to exercise. Not mandatory unless it's a part of their plan, but just another thing for you to think about. So, assistive devices. Assistive devices are items that maintain or improve ability. So, assistive devices are anything that help anybody do something or everyday task more easier. So I have glasses, which are assistive device, like grab poles, like like those poles in the handicap bathrooms, like those kind of poles. People can get them installed in their houses. Wheelchairs, artificial limbs, assist like custom eating utensils, driving modifications in the car for people with disabilities to drive. Anything that any device or any kind of technology that is created to help the individual live more independently is assistive technology. Um, so, as a DSP, familiarize yourself with your individual's assistive technology. Learn how to use it, so that you can also learn to teach them how to use it. Um, so yeah, and another big part of your job is advocacy. An important and an important aspect of advocating for individuals with disability is understanding ableism. So, ableism is defined as a set of beliefs or practices that devalue and discriminate against people with physical, intellectual, or psychiatric disabilities. And with all the other isms like racism, sexism, it's a belief that one group is more superior or better than another group. So with ableism, it's a belief that people who are able-bodied or people who don't have intellectual developmental disabilities are better than people who do have disabilities, which is just not true. And there's a lot of systems and structures that have been put in place that make life really hard, and disadvantaging and oppressive for people with disabilities. So understand that, and understand that you're their advocate as somebody who is able-bodied. Like advocate for them if you notice they're being treated unfairly in any capacity, whether it's by a family member, by a stranger, by a store associate, by anybody who is interacting with your individual. Speak up, say something, tell your supervisor if you think the group home they're living in is not giving them the best support, is not respecting their rights. Tell somebody, tell me, tell anybody in admin. Your job is also to advocate for your individual, because maybe they don't know how to advocate for themselves. So these are all of the things that we went over. Coping with stress and burnout. So, when an employee is stressed, they may overthink tasks and take longer to complete things than they normally would. Their emotions may be heightened, appear hyper, or feel fatigued. On the other hand, an employee who is burned out is more likely to describe feelings of exhaustion, helplessness, lack of motivation, and depression. Additionally, they'll become completely disengaged in your work. So, if you're stressed or you're burned out, you're not going to be operating at your 100%. So, It isn't. So, some reasons for stress and burnout: working too much overtime, having an unreasonable workload, so having a lot of clients at one time, experiencing personal stress. So, maybe you're experiencing things outside of work and you're coming to work, which is adding to your stress, over attachment to individuals, which can cause you to do things that are not in your job description, which can, contribute to stress. Having no outside work life, like not having going out, hang out with your friends, do things, do activities that you would like to do. But if you don't have that kind of balance and you just work, your life, it could be a bit more stressful and it might be easier for you to be burnt out. And not setting professional and personal boundaries can also be a risk for stress and burnout. So, what can you do if you're feeling stressed and burnout? Take time off. Limit your overtime, communicate with your supervisor, limit your relationships with your individual to a professional one, get a work life balance, know your duties as a DSP, and limit your work to those. Don't take more work than you can handle, and get a therapist if you need. So, thank you so much for watching. I hope you learned something. All right, till next time.